Hi friends, today we are going to discuss two very short topic of the antimicrobial, that is chloramphenicol and macrolids. Not frequently asked, but sometime some MCQ or SCQ can be asked from this topic. So first of all, chloramphenicol. Chloramphenicol is a broad spectrum antibiotic. The mechanism of action of the chloramphenicol is something like that. The chloramphenicol will bind reversibly to the 50S ribosomal subunit. It is very much similar to the aminoglycoside and tetracycline, but in aminoglycoside and tetracycline they will bind reversibly to the 30S ribosomal subunit, but in the chloramphenicol it will bind reversibly to the 50S ribosomal subunit, and it will prevent the formation of the peptide bond, and due to preventing the formation of the peptide bond it will inhibit the protein synthesis as usual. And they are bacteriostatic in nature. If we give it the chloramphenicol in the high dose, then it will act as a bactericidal also, and it will inhibit the mitochondrial protein synthesis by acting on the 70S ribosomal. This is the extent. After that, the adverse drug reaction of the chloramphenicol are, first of all, hypersensitivity reaction, skin rashes, urticaria, itching, dermatitis, like this. Then GI tract infection, nausea, vomiting, diarrhea and superinfection. Then bone marrow suppression. Dose dependent are anemia, leukopenia, thrombocytopenia, and if it is dose independent, aplastic anemia. These are the adverse drug reaction. Then gray baby syndrome can be seen as an adverse drug reaction of the chloramphenicol. This is asked multiple time in the MCQ, that gray baby syndrome is the adverse drug reaction of the chloramphenicol. It will reduce dehydration and detoxification of the drug in liver due to less glucuronide transferase. You have to just note, you should know that. These are the adverse drug reaction of the chloramphenicol. After that, the therapeutic uses of the chloramphenicol are typhoid fever, bacterial meningitis, anaerobic infection, rickettsial infection, eye and ear infection, and brucellosis. So these are the 5-6 therapeutic uses. You can remember it easily. So these are the therapeutic uses of the chloramphenicol. So we have done with mechanism of action, adverse drug reaction, and therapeutic uses of the chloramphenicol. This is all about the chloramphenicol. After chloramphenicol, we will move to the macrolids. The example of the macrolid is erythromycin, clarithromycin, and azithromycin. The mechanism of action of the macrolid is similar to the chloramphenicol, that the macrolid will bind to the 50S ribosomal subunit and it will block the protein synthesis. It's the same. Now you are familiar with it. The adverse drug reaction are simple hypersensitivity reaction, skin rashes, urticaria, itching, dermatitis, fever, etc. Then GI tract infection causing nausea, vomiting, diarrhea, abdominal discomfort. These are the adverse drug reaction of the macrolid. Then after that, therapeutic uses of the macrolid is that it is a drug of choice for some diseases like mycobacterial pneumonia infection, Legionnaires pneumonia, chlamydial infection, chancroids, diphtheria, and pertussis. These are the drug for which macrolids is a drug of choice. And for the other drugs, it is not the drug of choice. For the other disease, it is not the drug of choice, but it can be used, like in case of tetanus, in case of streptococcal infection, then MDR, typhoid fever, rheumatic fever, bacterial endocarditis, MAC, leprosy, H. pylori infection. For the disease, macrolids are also used. So this is the information about the macrolid, mechanism reaction, adverse drug reaction, and therapeutic use of the macrolid. So these are the two small topic. Sometimes a small question or MCQ can be asked from this topic. Thank you.